I'm Matt Bishar with REIT.com here in New York City for REIT Week 2014. Joining me for this CEO Spotlight is Debra Cafaro, Chairman and CEO of Ventas. Deb, thanks so much for joining us.
Glad to be here.
Well, I think the logical place to start is you've been in the news a little bit lately. Can you tell us about the deals?
Yes, Ventas just announced $3.8 billion of accretive transactions on Monday morning in two separate deals. One, we're acquiring publicly traded HCT and solidifying our position as the leading medical office building franchise and senior living franchise globally. We're also acquiring for $900 million the Holiday Canada portfolio, 29 independent living communities in Canada. And for clarification, the HCT transaction is about a $2.6 billion enterprise value transaction. It's a stock-for-stock deal, so very balance sheet friendly. And also in the HCT transaction, there's a very exciting pipeline of additional potential transactions of over $250 million. Again, mostly senior housing and MOBs.
Now, one of the other big stories for Ventas lately has been your growth in FFO. Is this a story of improving operations or a more hospitable operating environment?
One thing we really pride ourselves at Ventas is really growing consistently our cash flow, our dividends, and our funds from operations over all economic cycles. And in fact, we have grown FFO per share, I think 10% a year for the last 10 years or more. And so we really pride ourselves on being able to consistently grow through all kinds of environments. And we've been able to continue that this year so far, and then we hope that with the deals that we announced, again, 10 cents accretive in 2015, that we'll be able to continue that. The FFO growth is really coming from 3 or 4 important pieces. So we have excellent internal growth because we have really productive assets. We've been able to continue to refinance at consistently lower rates, so we're getting interest rate savings. We're doing development and redevelopment within our portfolio, so that's adding. And then of course, as I mentioned, we've done $16 billion of deals since 2011. Now we're adding another $3.8 billion on top of that. So there is a significant external piece. And when you put all that together, that's how we've been able to grow FFO consistently and dividends consistently over a very long period of time.
Now, looking globally, what plans do you have for international expansion, and how important is a local partner in those plans?
Well, that's a really good question. I really believe that international expansion can be an important part of the evolution of our growth and diversification strategy, which really began in 2002. And we have identified selected international markets that have 2 characteristics. Either they have an aging demographic in the way that we have in the U.S. and well-developed healthcare and senior care infrastructure and rule of law. So that's one category. The other category is really developed democracies where you're seeing a burgeoning middle class and an underserved healthcare infrastructure. And those would be the 2 types of countries Ventas would consider investing in. Right now, we're in Canada. We've been in Canada since 2007. We just did a great hospital deal in the UK. And I think after the Holiday transaction, Ventas's NOI from international will be about 5% of our total portfolio. And then secondly, to your question about partners, it's very interesting. The healthcare REITs are a little bit different than the other REITs expanding internationally. Under the REIT rules, as you know, like lodging, we always are working with a manager of our assets or a tenant of our assets who is we call our operating partner. And they're the care providers typically. So in those areas, we will definitely have local partners, and we have great expertise, frankly, because that's our business model. We're always working with a local care provider, whether it's domestically or internationally. And so that's quite an easy fit for us as we look at international markets, to be working with leading hospital systems, leading senior living providers.
And lastly, you know, for the whole healthcare sector, the Affordable Care Act continues to sort of hang over everything. How difficult has that been to operate, and is it a challenge to keep the company nimble to deal with wherever the winds may go?
At Ventas, we have some huge tailwinds in our business, and the Affordable Care Act is one of them. We have the aging of the U.S. population, the over 85 fastest growing segment of the U.S. They, of course, use our skilled nursing assets and our senior living. We've got the 79 million baby boomers who I'm a part of, and we know that that cohort is the so-called pig through the python. So a lot of demand for our medical office buildings from that cohort as they become Medicare eligible starting in 2011 and start to utilize healthcare in a more frequent basis. So we think that increases utilization for medical office. And then lastly, we do have the Affordable Care Act, which will bring 25 million formerly uninsured people into the healthcare system. And we also think that will increase utilization of medical office. So we think it's a net positive for our business. And the last thing I would say is the other policy piece that's important for our business is there is a push both in the Affordable Care Act and just generally as part of healthcare policy in the U.S. to continue to serve patients in the lowest cost, most clinically appropriate setting. And our medical office and skilled nursing assets in many cases are that setting. So that's another positive for our business as we look forward.
Deb, thank you so much for joining us.
All right, thank you. It's a pleasure.
For more on this and other REIT news and analysis, be sure to visit REIT.com.